Good afternoon. I'd like to welcome everyone to the 30th annual Dr. Martin Luther King Jr. Day Health Sciences Lecture. And in addition to all of you joining us here in the auditorium, I'd like to thank those who are joining us and welcome those who are joining us via live stream. So yes, 30th annual. For 3 decades, our schools, the health sciences schools, have collaborated on this incredibly important event. It has endured and thrived thanks to the indelible and inspiring spirit and teachings of Dr. King and to the committed advocates who take up the mantle each year at the campus to deliver the fine programming. I'm reminded, some of you know, I'm less than 24 hours from returning from an international trip to Nairobi, Kenya, and then a second part to Ethiopia. And while there, had discussions, particularly in Ethiopia with all of the rich history there, but Dr. King's name came up in several conversations. And so it was a reminder of just the global presence that Dr. King had around the world. And there's certainly a domestic part of that we all gather to celebrate on an annual basis, hopefully carrying that message throughout the year. And then I'd also like to say specifically, it's particularly important to me because my alma mater, Morehouse College, and I know there's at least one notable alum here in the audience who's also from Morehouse College, but for all the accomplishments that we make, just thinking about Dr. King, who's the most famous graduate from Morehouse College, that we all have a lot of work to do in moving forward. So it's an honor to join with my fellow health sciences deans to host the lecture. Each year, the responsibility of hosting rotates between all of the health sciences schools. So I'd like to thank Dean Patricia Hearn for hosting last year and passing the baton to us in the School of Public Health this year. And also to thank Professor Emerita Patricia Coleman Burns for her leadership with the Health Sciences Committee. I know that there are some deans in the audience. If I can ask you to also stand from the health sciences schools to be recognized. A year ago, the MLK Symposium and Health Sciences Lecture were among the early campus-wide events that I attended while beginning my deanship. And those events really reminded me why people come to the University of Michigan. So students, why they want to be here, for faculty and staff, why they want to work here, and for deans like myself to come back to the University of Michigan. At Michigan, we're committed to developing leaders and citizens who will challenge the present and enrich the future. By bringing visionaries, disruptors, and thought leaders to campus, we enhance what happens in the classroom and really help to prepare our students to go out into the world and have high impact. We're very pleased to have Dr. Jalonne White-Newsome here as our featured speaker today. You'll hear more about her in a moment and then from her, but I just want to say that I'm very excited to have her here present with us and to hear and learn from her, given her expertise on climate, health, and equity. The schools and units of the health sciences group are bound together by our collective pursuit of health equity, and that's what makes events like today so meaningful, our common purpose. I hope you'll all be present for that purpose today and then continue to reflect and act on what you hear. Before I go, I'd like to also thank the Health Sciences Planning Committee for their commitment to bringing us programming like this, and I would also like to take a moment to ask any members of the Planning Committee to please stand. It's important to recognize the work of groups like this because none of them came to the University of Michigan or were hired at the University of Michigan to dedicate their efforts to these kinds of things. So they're going over and above their classes. They're going over and above their day jobs because they care. They want to maximize the impact and helping to change and make the institution the best it can be and broaden their impact on society. So I thank you for all of your efforts in the work in bringing us this program. Now I'd like to invite Nichole Burnside, the School of Public Health Diversity, Equity, and Inclusion Program Manager, to introduce our distinguished speaker. Nichole?
Thank you, Dean Bowman. As Dean Bowman said, thank you for choosing to spend part of your day with the Health Sciences Committee. One of our cherished traditions over the past 30 years has been joining together to sing, Lift Every Voice and Sing. In a moment, we'll play the song throughout this auditorium and we'll have the words playing on the screen. Please join along.
Lift every voice and sing, till earth and heaven ring with the harmony of liberty. Let our rejoicing rise as a listening sound. Let it resound loud as a roar. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of our new day, let us march on till victory. Don't leave the road we are, bitter the chastening, fell in the days when unborn. Yet with a steady beat and not a weary, come to the place where which I came. We have come over the way which the Spirit will water. We have come, treading our path through the blood of the Lord. Out from the gloomy path, till now we stand there, where the light gleam of our bright star. Out of our weary fears, out of our silent tears, Lord, who has brought us far on. Thou who hast by thy might led us into the keep us forever in the path we pray. Bless our feet, straight from the places, our God, where we met thee. Bless our heart, drunk with the wine of the world, we forget thee. Shadow beneath thy hand, may we forever stand true to our God, true to our native land. Thank you for all lifting your voices and singing, and Dr. Esther leading us in that lift every voice and sing. Thank you. Let's give ourselves a hand for a little impromptu. All right. Okay. Before we move into today's programming, I would like to take a moment and look back.
The University of Michigan is located on the traditional territory of the Anishinaabe people. In 1817, the Ojibwe, Odawa, and Potawatomi nations made the largest single land donation to the University of Michigan. The donation was offered ceremonially as a gift in the text of the treaty at the foot of the rapids so that their children could be educated. Through these words of acknowledgement, their contemporary and ancestral ties to the land and their contributions to the university are renewed and reaffirmed. For 30 years, the Health Sciences Committee have been committed to celebrating the life and achievements of Dr. Martin Luther King Jr. through thought-provoking programming. Our collective goal is resolving health inequity. We also aim to provide programming that honor Dr. King's lifelong commitment to confronting injustice. He once said, "Of all forms of inequality, injustice in healthcare is the most shocking and inhumane." On the screen behind me, we have included a sampling of our speakers from the past 30 years. We will pause now so you can take in this incredible group, bonded by their timeless dedication. Each speaker helped bring to focus a particular issue of that time, and Dr. White-Newsome will join this illustrious group today. What this reflection demonstrates to me is while the road is long, it is right, and it is just. We are grateful for the long-standing partnership of the Health Sciences Committee. To reach 30 years of partnership, we know it has been critical to remain relevant and impactful. In a moment, I'm going to turn things over to Dr. White-Newsome, but before she takes the stage, let me tell you a little bit about her. I could read her bio, and I will hit some of the highlights, but I want to share a moment from our first planning call with her. A few months ago, we connected about her presentation. We talked her through some of the logistics and expectations of the day, and then turned it over to her to see if she has any questions. As you might imagine, there are probably dozens of items she could have inquired about. From the beginning, though, she wanted to know what was happening on campus. What are the students concerned with? What are faculty and staff talking about? What is the culture on campus, and how are students, faculty, and staff engaging on campus? It was a poignant moment for me because it demonstrated that she was focused on the community she would present to today. That perspective is why she continues to be an in-demand expert.
Welcome to Blue Jeans.
At the intersection.
To connect to the meeting using your remote control,
Okay.
Please enter the meeting ID followed by pound or hash sign.
I am not sure what the system is doing, but it's working with us today. It is a poignant moment for me because it demonstrated that she was focused on the community she would present to today. That perspective is why she continues to be an in-demand expert at the intersection of climate, equity, and health. Currently, she is a senior program officer at the Kresge Foundation, responsible for the Environment's program grant portfolio on climate resilient and equitable water systems. She previously served as the Director of Federal Policy at West Harlem Environment Action, where she led national campaigns to ensure that the concerns of low-income communities of color were integrated into federal policy, particularly on the issues of clean air, climate change, and health. And today is a bit of a homecoming for Dr. White-Newsome. She earned her PhD in Environmental Health Sciences from the School of Public Health. We are so pleased to have her here today. Please join me in welcoming Dr. Jalonne White-Newsome.
Good afternoon. I won't be playing any videos, but it's all good. Thank you for the impromptu because you do not want me to sing, so I'm so glad you did that. Thank you so much. My goodness, it has been a powerful morning, and I am truthfully just still taking in this morning from the conversations I've had with students and faculty to hearing the awesome Angela Davis speak. It has been a deep morning. But it's been good. It's been good. Thank you so much for the kind introduction, Nichole. She has been babysitting me all day and making sure that I've been taken care of, so I want to appreciate you in front of everybody. Dean Bowman, thank you for being here after your trip and no sleep and still smiling, and I look forward to getting to know you better, so thank you. But before I begin, I just want to again appreciate the acknowledgement of the land that's been happening on this campus. That is one thing that I've been trying to do in philanthropy. So really acknowledging again the original inhabitants of the folks that were here before us, that took care and that were stewards of this land is so important. So thank you, University, for making that a part of what you do in your practice. That is awesome. I want to also appreciate those that have helped pull this together, the Health Sciences Committee, the students, the offices of diversity, equity, and inclusion for the campus, as well as within the School of Public Health. I know this just doesn't happen on happenstance, so thank you all who feel like this is truly important and it needs to keep on going even beyond the 34 years that it's been happening. So last but not least, I definitely want to thank my University of Michigan colleagues, the folks that got me through this university, Dr. Joliet and Dr. Marie. I'm not sure if she's here. My friends and family that are here today, the woman who birthed me, Terry Weathers Henderson, my second mom, Granny P, my stepdad, Dr. Henderson, my fabulous uncle, James Weathers, and my brother, Michael Henderson, who stepped in, another University of Michigan graduate. My aunts DeWanda sitting in the back, my great aunt, Aunt Maud. I roll deep, as you see. My Aunt Carol, who is wonderful and an educator as well, my husband Huey, and my wonderful daughters, Ariel and Jay Annalyn, and JJ just celebrated her 11th birthday yesterday, so we're coming high off of a party last night. So thank you all. So, and I feel like, can you all see me over here? Okay, all right. And unfortunately, I have to stand behind, but hopefully it'll be okay. So, I will tell you, before I came to University of Michigan, the bigger connection between climate change and health really didn't crystallize for me professionally nor personally. As a new doctoral student in 2007, I was eager to find out what in the world I was going to focus on for the next 3 to maybe 8 years of my life studying here at this institution. And I was fortunate to receive the help and guidance from Miss Dana Thomas in the School of Public Health Practice. She introduced me to several leaders in the Detroit Health Department. And what was amazing is that at that time, the department wanted to know how they could reduce the risk to senior citizens across the city of Detroit that they were experiencing due to extreme heat and heat waves. And so what's interesting is that this conversation became personal to me very quickly. In fact, as one of the primary caregivers for my grandparents who were then in their 80s and 90s, I began to witness changes due to the onset of Alzheimer's in both of them. It became challenging to explain to Nana and Granddaddy why your house is too hot and this is not good, why you needed to turn on the air conditioning or open windows and doors to stay healthy and safe. But they didn't always understand. But what I soon realized is they weren't the only folks that were exhibiting those behaviors. Watching them, this research on extreme heat and heat waves was no longer just a way to get my PhD. With my advisor and my committee, Dr. Marie O'Neill, I became vested at this intersection of climate change, health, and equity. And I learned quickly that similar to most other social problems, most of those who were unfortunately suffering were people of color and low-income people, and in particular, those that were houseless or homeless. So armed with a passion for equity and knowledge of our state and our city's history on climate, I embarked on this journey, and I brought my family with me, much like I did today. My grandparents, my great aunts, and about 20 other volunteers across the city of Detroit participated as data points for my research. I wanted to better understand how heat exposure across the city of Detroit including the health risk inside homes, so heat exposure and the risk inside your homes. I also wanted to understand what were the behavioral interventions that we could do better to protect folks And again, I got to engage with a lot of senior citizens across the city. And I don't call them seniors, I call them holders of wisdom. Because when I went to talk about climate change, they told me stories about the Jim Crow era. They told me stories about growing up in Mississippi. And they told me stories about all the challenges that they continue to face north of the Mason-Dixon line. So I came with an agenda, but they came with another one. After I decided to study heat waves, it was interesting because I figured out that I was actually a part of two of the biggest heat waves that we had ever seen, the Chicago heat wave and the Parisian heat wave. Both were devastating. But as a proud native Detroiter, I soon learned that through my research that there had been decades of heat waves right here in the state of Michigan that had impacted the health of Michiganders over decades. But never, and I want to punctuate, never at the frequency and intensity that we see them today. So in fact, one of the deadliest came to Detroit in the 1930s, and it claimed the lives of at least 364 folks. And that was due to 5 days of 100+ degree temperatures. And people succumbed to the heat in their homes. They succumbed to the heat walking to work, going to school, just doing daily stuff. Again, at that time, fans weren't working. Air conditioning was not prevalent in homes and places of business, and there were no cooling centers or public health precedents set to protect folks during heat waves. So the threats and the reality of climate made their mark. So back in the 1930s, heat wasn't the only problem in the United States, as you can imagine. There were 24 recorded lynchings. The NAACP defeated the confirmation of Supreme Court nominee John Parker, who was on record for opposing voting rights for African Americans. And in 1933, the scholar Carter G. Woodson published The Miseducation of the Negro. And amazingly, 87 years later, this work is a part of the theme of this campus-wide celebration of Dr. King and the impetus for this symposium, The Miseducation of Us on Climate and Health. I believe Dr. Woodson and Dr. King's writings, although decades old, continue to share relevant truths that can guide the necessary actions that we need to take on climate change and health in our current social context. While 2020 doesn't exactly mirror 1933, I posit there are some similar challenges now. Among them, that we are living in a world of severe injustice, with unnecessary killing and suffering of people of color, not only from police officers, but from healthcare and health systems that do more harm than hurt. That we have an education system with teachers that are quick to label our Black and brown students as disruptive and send them quickly into the school to prison pipeline without trying to understand the full context of their lives. That thousands of Black and brown communities suffer daily from environmental injustices such as allowed pollution, inadequate infrastructure, a prioritization of industry profits over people, dirty air, lack of regulation of coal-fired power plants, large sites of hazardous waste, fracking pads, freeways, severe and repeated flooding leading to displacement. It's clear the impacts of climate change hit our Black and brown communities first and worst, across this country due partially, and some might say fully, to structural and institutional racism. So in that stark reality, I want to take a couple moments to use Dr. Woodson's and Dr. King's work as the foundation for our conversation today, lifting up three main points. One, the purpose of education. Two, the perpetual nature of miseducation. And leave on a high note with the promise of re-education. The purpose of education. Now, Dr. King spoke on a lot of topics, but again, he spoke and really shared in a piece the purpose of education in February 1947 in the Maroon Tiger, the campus newspaper for Morehouse College. And he addresses the truth about education with 3 points. He wrote, "Education must enable one to sift and weigh the evidence, to discern the true from the false, the real from the unreal, and the facts from the fiction." He wrote, "Intelligence plus character, that is the true goal of education." And finally, the broad education will therefore transmit to one not only the accumulated knowledge of the race, but also the accumulated experience of social living. What I believe Dr. King is telling us as we talk today about miseducation on climate and health is that we must discern fact from fiction. I know it's hard. Education is not just about books, but experience. And having some character and integrity with traditional education is critical. So that is the true purpose of education, particularly for those of us in this audience and beyond this audience that care about the health of people and the health of communities. The perpetual nature of miseducation. So I was an undergrad at Northwestern University back in the day when the internet was just born. Before then, some of you of a certain age might recall the Dewey Decimal System in card catalogs and libraries, and how when you wanted information, it was either word of mouth or you actually, watched your favorite news reporter, read a peer-reviewed journal, or had a magazine delivered by mail. Fancy that. I trusted those sources of information. But that's not the case anymore. With the internet, Twitter, Snapchat, blogs, podcasts, all this information moving around at the speed of light, it is hard and it can be overwhelming to sift through this information, particularly on this topic of climate change and health. Well, let me help you here. There is one source that I want to point to, the Lancet report, again, that was released last November. That's an international, interdisciplinary collaboration to monitor the evolving change in public health. It's an example of a good source. This report provides an annual update of over 41 indicators across 5 domains related to climate and health. And I just want to share a couple of points in this report. Hopefully, it'll make you go and read it if you haven't. The first, the combustion of fossil fuels suggests that the world is following a business as usual pathway. In fact, the 8 of the hottest 10 years have happened in the past decade. That the healthcare sector is responsible for 4.6% of global emissions. Air pollution deaths have reached 7 million globally. The top conditions putting families and livelihoods at risk are wildfires, floods, and heat waves. Economic losses for the uninsured are placing a high burden on individuals and households. And what we don't want to forget, and I want to punctuate, the downstream impacts of climate change, migration, poverty exacerbation, violent conflict, mental illness are affecting everyone of all ages, particularly our children. So what got our nation and our world into this mess? Indisputably, across many reports, including the Lancet, the National Climate Assessment, and others, it's a clear combination of at least 4 factors, and I added one for the fun of it. One, for my scientists in the room, human cause factors. So again, fossil fuel combustion, coal, gas, oil, anything that puts gases like this into the air is a driver. There's some natural drivers like volcanic eruptions, some synthetic manufacturing of gases like CFCs and halons that do contribute. But a factor that I like to throw in is that thing we call capitalism, that thing that continues to make our society churn in the way that it does. So without a doubt, the impacts of climate change on health and life are evidenced in the storms, the droughts, the cold waves, the heat waves, the hurricanes, and the constant stories of destructions, loss of life that we see every day. But how does this global problem become an even bigger problem for lower income communities and communities of color? Well, let's ask the national academies, again, another trusted source. In particular, a comprehensive paper that they published back in 2017 that provides a little bit of an explanation of health inequity. It says, all right, health inequities are a result of more than individual choice or random occurrence. They are the result of historic and ongoing interplay of inequitable structures, policies, and norms that shape lives. Take a minute to reflect on that. When you think about the drivers of climate change, who is feeling the impacts the first and worst? And the context of those communities. it becomes really clear why our brothers and sisters in Puerto Rico didn't get the response that they deserved. It becomes clear why certain more affluent communities were told to evacuate in California when the wildfires hit and others weren't. It becomes clear why folks living on the east side of Detroit continue to suffer from repeated flooding from increased precipitation driven by climate change, when right across the street in Grosse Pointe, there are concrete structures to protect the high wealth residents and their homes. This miseducation on climate change and health is a result of misinformation, misassociation, and just plain old missing the mark. This miseducation becomes even more dangerous when it is in the mindset of which our leaders lead, our teachers teach, and our decision makers decide. This miseducation in our society has unfortunately led us to allowing the market to conduct business as usual, to convince the masses that climate change does not exist and there's no problem or the problem's too big to solve, or continuing to weaken and in some cases slash our current environmental regulations and permitting processes that diminish the power of governmental agencies that were put in place in the 1970s to protect our air, water, land, and health. Yes, I believe we have been miseducated as people of color, as people of this nation, about climate, and as people concerned in general about the health of their communities and the people they care about. But the good news is, we can re-educate. And that brings me to my last point. So in a country that is overcome with hate, injustice, lack of accountability, institutional and structural racism, how do we begin to re-educate ourselves? Dr. King suggested that we need to see through the propaganda. So the list of propaganda to dismantle can be real lengthy, but here is where we can start. Despite the propaganda, health disparities and climate change are not the fault of the most impacted communities. They've in fact been driven by those with the most financial wealth. That's all right, we're going to keep on going. Despite the propaganda, solutions created without the experience and the brilliance of communities that are on the ground, whether they be grassroots, frontline, or just a local mom that cares, they will fail if they don't include those voices. And despite the propaganda, we have to address the systemic and institutional racism across all sectors working on climate. Because if we don't, we will continue to address the symptoms, but not the root causes of these issues. So we dismantle this propaganda by, I believe, sharing what works and where we're seeing progress. And I want to share with you just a couple of examples of where we are dismantling this propaganda. So since we are in a hospital, I thought I'd start with some wonderful folks at Healthcare Without Harm, international, national NGO that is doing great work to minimize the impacts from hospital systems on our climate. They're working, again, to really start a sustainability movement with physicians and networks across the country and reduce the carbon footprint, as I said before, of health and hospital institutions. One of the things that I'm really proud of is that they're actually trying to, again, connect with communities and serve as the anchor institutions that I think hospitals can do a better job in doing. So definitely take a look at their work. The Alliance of Nurses for Healthy Environments. This is the only national nursing organization that is really focused on environment and health. And they have just started this 30-person fellowship where nurses are working on climate and health projects across the country, in community and with community, on all sorts of issues from flooding, heat, etc. But really excited about the work that they're doing. Policy Link, a national known organization for just engaging with the poor and those that are in poverty. And I'm so proud that they are working with the Gulf Coast Law and Policy Center to do a couple of things. But one, stand up this caucus working on climate resilience in the water space. One of the reasons that flooding is a huge issue is that it's been ignored. And oftentimes the flooding impacts, again, our communities of color and our low-income communities more. So this caucus, they've pulled together over 90 grassroots organizations across the country to create a policy platform that they have been pushing all last year, and in fact has resulted in increased appropriations to the Environmental Protection Agency for WRDA and other legislation. So they are doing their thing. I want to also acknowledge Peggy Shepard, my old boss, but again, as a part of a fabulous organization that has been working on climate and health for many years. But what I want to also highlight is they are about education. They spend time training from young youth to adults about what they can do to impact, again, climate in their space, and particularly in the community of Northern Manhattan. I want to also highlight the work of Groundwork USA, again, another national organization that has chapters or trusts across the country. And they've done this interesting project where they're overlaying redlining maps with maps of flooding and heat to see where the impacts are happening. And then using this kind of vulnerability assessment to say, hey, this is where we need to focus our advocacy and our work. Because you do know that when we talk about institutional and structural racism, that it didn't just happen as a coinky-dink, that most people of color and low-income color end up in places with less infrastructure, with less green space, with less access to resource. There's a reason for that, and they are trying to prove that using data and science and community brilliance. I want to uplift Laura Hansen, who is one of the national adaptation leaders across this country, and she does a lot of work with institutions, with governments that are making decisions about how they're going to plan or not plan for climate. And so she is doing awesome work, has a huge database of the things that are working. And again, so there is no excuse that we cannot find the resources and people to get us through this. And Donnell Wilkins of Detroit, Michigan, probably don't have to say much about her. She has been a stalwart in health and equity for many years. And again, pulling together education, but also the importance of economic and workforce development, that everybody should benefit from our environment being safer and healthier, definitely our people of color and low-income people. And now philanthropy, again, which is an institution with its challenges. We have been making, again, an effort on the Kresge side to really talk about and act and support organizations that are working at this intersection of climate change, health, and equity by supporting institutions like local public health departments, practitioners, as well as community-based organizations through our most current initiative. And I just want to say, broader than just the Kresge Foundation, there are a group of funders out there called the Health Environmental Funders Network that are focused on environmental and health justice funding. And we are trying to talk about racism within the funding community. We are trying to figure out how to be better grant makers. And I serve as co-chair for that organization. I'm very proud of the work that we've been doing and that we're going to continue to do in philanthropy. So, in conclusion, I encourage us all to reflect on the ideals of Dr. King, the words of Dr. Woodson, and really the upcoming 50th anniversary of Earth Day that started at this institution. And I believe we can activate our own power, really looking at four things: humility, healing, Harambe, and hope. When we talk about humility, we need it in our decision makers, our leaders, in academia, in the finance sector, health, government. We need it everywhere. We must begin to humble ourselves and acknowledge the past and current structures that have made this situation worse than it needs to be. The fact that we have allowed these institutions and structures to allow our communities of color and our poor people to suffer more by no cause of their own. We have to continue to connect the dots between these institutions and what we're seeing and make a change. More importantly, we need time to heal. So once you acknowledge the wrongs that have been done, it's hard sometimes to be friends with folks that have treated you wrong. So if we have to allow time for that, and that's super important. And the rebuilding of trust is not something you can do overnight. It takes time. Harambe. In the past 3 years, I have witnessed so much Harambe going on. It is a beautiful thing. Again, people, organizations, mainstream environmental, EJ, social justice, folks that have never talked or worked together before have come together to create concerted agendas to address these inequities that we're seeing in climate and health and everywhere else. So again, we must continue to connect and work together intersectionally, and most important, make each other's fight our own fight. And finally, we must remain hopeful. As Dr. Carter G. Woodson said, if the highly educated Negro would forget most of the untried theories taught him in school, if he could see through the propaganda, which has been instilled into his mind under the pretext of education, if he would fall in love with his own people and begin to sacrifice for their uplift, if the highly educated Negro would do these things, he could solve some of the problems now confronting the race. We all could solve the problem of climate change confronting our race. I think this can be a lesson for us all, whatever race, whatever we are. Let's not stay miseducated, but take the time to actually re-educate ourselves. We need to respond head-on to institutional and structural racism wherever we sit, and reform what's not working in our multiple systems so we can actually revitalize the health and wealth of our country, particularly for our low-income communities and our communities of color. So it's 2020, y'all, and the time is now. And as my daughters would say, it's time to level up. So thank you, God bless, and be of service and in service to each other and humanity in whatever the work that you do. Thank you.
Thank you, Dr. White-Newsome, for that presentation. And we sincerely appreciate you giving us not only the challenge in thinking about health equity around climate change, but giving us that 4 pillars of ways that we can be actionable ourselves and make a difference. And the one thing that resonated with me, you said, make my battle, take what I own, and it's someone else's battle. So we share the load in helping each other navigate these challenging situations. Thank you again. So at this time, we're going to have a few questions from the audience. If you will have individuals walking around with microphones. If you talk into the microphone, it will allow us to hear you and the individuals on live web stream. So now if we have any questions. Okay, 1 second.
Hello. Good afternoon. My name is Marcus McKay Jr. I come from the School of Public Health, Department of Epidemiology. I am curious to know how public health is one of the preventative sciences offered as a form of education. I just want to know, outside of educating a community, what are ways that public health can get in front of health inequities after severely impacting the community through climate change?
Thank you, Marcus. Did I hear your name? Okay.
Yes, ma'am. Mm-hmm.
All right. Thank you so much for your question. So I'm a firm believer, particularly, when you're at an institution of higher education, that, making the effort to go and listen to communities and understand what they're dealing with, what is causing concern in their community, because oftentimes the first thing out of their mouth is not going to be climate change. And so oftentimes in my experience, researchers, and again, I'm just speaking from personal experience, we have our hat on that this is what I need to do to finish my thesis, my dissertation, which is super important. But I think what is so cool is that you have the opportunity to inject something else that could potentially solve another problem that they're dealing with. Because again, in communities, oftentimes it's about how am I going to address the issues of my family. So whether it's putting food on the table, whether it's, they're having trouble with the educational system or, police violence, it's like really understanding how those issues impact community, but also making that a part of what you do as well. So, I feel like climate change can be the connector to so many different issues that folks are feeling. And so as a public health student or a public health researcher, it's always important to understand what are those issues that community is dealing with, and then begin to help and work on those, that you can start to build relationship, and then the pieces of climate and health naturally can come into that conversation. So again, I'm big on listening. I'm a big proponent of trying to make climate, work within, different issues and things that come up. But that would be my advice, to get in front of stuff, because if you begin to work on the other issues and the other problems that a community is facing, building that infrastructure is so important when you begin to try and introduce climate, or these things that folks are like, I don't have time to care about climate, I don't know how it impacts me. So really taking the time to build that relationship and that scaffold is super important.
Okay, thank you.
Mm-hmm.
You won't need to go to the gym after all that running around. Thank you so much. I'm Patty Hearn, from the School of Nursing. First of all, thank you for a marvelous talk. It's rare that I hear so many interesting facts, important concepts, and pure love of people come through so well. I want to ask a question about healthcare and something related to climate change, but perhaps also related to sustainability. As you may well be aware, our health systems and enterprise in the United States is not only one of the largest producer of things which might be interpreted as being damaging to the climate, but we have enormous amounts of waste that's being produced. And I wonder if you have any thoughts on that and where we might perhaps unite just around climate change, but as healthcare providers and people very much engaged in this, what could we be thinking about in the future?
That's a great question. That's why I really uplifted the work of Healthcare Without Harm, because they actually got started as a group of folks that were fighting incinerators around medical waste. And so how you manage waste streams, how you inhibit the production of those waste streams is really wrapped up into what they do. And so first, I think it's just understanding and, in working with Healthcare Without Harm, really the understanding that the healthcare system and leaders realize the impact that they are making, because oftentimes just that level of understanding is not there, and that's not by no fault of your own, but so there's an opportunity, one, for education. And then as with any process, is there a way that we can still do and serve the folks that we need to serve, where we can generate less waste, particularly less hazardous waste, that again is going to end up in an incinerator that you're burning in the community. Primarily incinerators and other major point sources are typically located in communities of color, so you're actually harming the community by getting rid of the waste that you generated. So it's this crazy cycle. So I think there are great models out there of, again, with Healthcare Without Harm and other hospital systems that have taken that head on. And I'm happy to, if you're not already connected with them, to connect you with them, because they probably have a better answer than I'm able to give you. But folks are doing it. And some of the biggest hospital systems, particularly Boston, Seattle, and one other one I know are kind of like leading the pack.
Thank you. Stephen Modell, Epidemiology and Health Management Policy. A somewhat related question, but about community-based organizations. Around 20 years ago, our group had a collaborative all-day conference with We Active Harlem. And We Active Harlem was very concerned about contamination, pollution around urban sites, such as waste dumps and lead contamination in the neighborhoods. And they had a natural talent at being sensitive to issues that were facing the community. But at the time, 20 years ago, they were mostly concerned about things like pollution. Climate was something that hadn't yet risen to the fore yet. My question to you about community-based organizations is, do you see new organizations rising to the fore to tackle issues of climate change, or a conversion of existing CBOs such as We Act taking on climate onto their menu of activities and concerns?
I appreciate that question. What I will say that a lot of the organizations that have been working in the environmental movement, climate change is driven by dirty air. And most of your traditional environmental organizations have been working on dirty air for a long time. So I think what has happened is that, again, this understanding that, all the issues that we're working on, whether it's dirty air, waste, lead, all of those things are made worse by climate. They're exacerbated. So I think it's a natural progression that we're seeing, and really it's about making the connection. So not that it's a new issue, it's just making the connection to stuff that folks have been working on for decades.
Hi, my name is Claire. I'm a practicum student, graduate for School of Social Work, and I'll be at Detroit Children's for my summer-spring semester. So I'm from Chicago, and I'm just learning about the heat waves that Detroit has had over their past summers. Is there anything that I should be concerned or talk to the parents / patients about with the heat, or what goes on in the Metro Detroit area during the summer / spring?
Yes, definitely. I think I mentioned it, maybe if I didn't, children are the most affected by climate change. And when you think about the level of vulnerability, it's our babies, children, our senior citizens, then those that are dealing with chronic diseases, particularly around the cardiovascular system. So I would encourage you, again, it's a lot about education. And folks aren't aware of that. They aren't aware of the cycle of heat stress to heat death. And so as we think about our children that, again, are just simply playing outside on a hot, hot day, a lot of our children, unfortunately, have asthma and other conditions that make them more vulnerable. So particularly just having that baseline education that when it gets hot or a certain temperature or a certain humidity, you need to be extra careful. You might not be able to play outside as long as you do. But then also, I would say the understanding for parents and coaches, all these folks that, particularly when you're playing outside and, children have sports outside, particularly high school sports, there needs to be an awareness of, this temperature is not just that it's hot, it can be deadly, unfortunately. And so, there's so many examples, particularly when I lived in the South and in Dallas, Texas, how some gymnasiums are not even air conditioning. You would think, how could it not be AC in Texas? But that is the case in a lot of places across this country. In schools, there's sometimes not air conditioning. So I think there has to be a massive undertaking of just simple education that, some of the places that are supposed to protect us are not actually protecting us. And so whether it's parents, whether it's educators, daycare centers, all these places that are supposed to take care of our children, we have to make sure that they are prepared both in practice and that, when these things happen or when we get these extreme conditions, that they know how to operate. I also think it's important to let folks know, like what are the other services that are out there that can help in this case. So there are cooling centers, usually. So whether those are libraries, malls, etc. Children walking to school. There are sometimes transportation systems that are created when, again, you have this extreme weather. So I think having a really clear understanding of what are those other resources that folks can tap into, not when it happens, but before, is super important. So that preparedness piece is critical. So those are just a couple of ways that I share with the children. Yeah.
Let's all give Dr. White-Newsome one more round of applause. We have a token of appreciation for you. You can come over and, come.
All right. Thank you so much for presenting an extremely powerful message. And she alluded to the fact that we're celebrating this year the 50th anniversary of Earth Day, which has its roots right here on the University of Michigan campus. And so I can't think of a better message that ties together health, what we're seeing and experiencing in terms of climate change and what we can anticipate in the future. And we all have a role to play, whether it's continuing to generate the evidence, connecting health to climate change, whether it's things dedicated to preparedness, or not forgetting about those communities that are impacted in times of need. So I want to just express again my sincere appreciation to you for your insightful message to us, and hopefully it's left a charge not only in me but in other members of the audience today to play our part in addressing these issues. So I'd like to express our appreciation by delivering this plaque to you, and thank you so much.
Thank you so much.
Actually, that's,
In just a moment, we'll end our formal programming, and you're invited to join the reception directly outside of the auditorium. The Health Sciences Committee encourage you to continue our collective work around health equity. And in the spirit of that, please join us at our next event on February 25th, with Dr. Carolyn Finney will be speaking and leading discussion on environmental justice and implementing change. This event will be hosted at the School of Public Health. As you exit today, we ask that you take a survey from one of our volunteers and fill it out and leave it in one of the bins. Today, we celebrate and translate MLK's legacy of critical perspectives on health inequity through our unique perspective as health science educators, clinicians, practitioners, researchers, and lifelong learners. Let the spirit carry us forward throughout the year. Thank you again for joining us, and please join us for fellowship at the reception. Thank you.